Hey guys, so let's jump in and talk about some of the pros and cons about being a DON. All right, now in this position, and this is some of the things we just don't think about, there comes a lot of responsibility. Okay, so I want you to start thinking about the pros and cons before you start accepting that position, because it is a big responsibility coming into these positions. Okay. So one of the pros that I like is the autonomy that it brings. All right, as a DON, you have the ability to make decisions in your facility. Okay, I also like the ability to impact the lives of others, whether it be my patients or my employees. Okay, that's another pro that you have going into these positions. Networking. Okay, networking is a big thing when you get into the DO1 role. Okay, not only are you going to start connecting with other DONs, but you're going to start going to different conferences that lead you into connecting with regional nurse consultants, legal nurse consultants, different types of physicians, different types of associations that are geared to help, directors of nurses or just nurse leadership. The other thing that you have that when you get into this position is the ability to grow. Okay, so the ability to get into like perhaps a regional nurse consultant position or a vice president of clinical operations, president of clinical operations. So when you land this responsibility, it opens up other doors for you in terms of your skill set. Okay, salary. Okay, salary. Always important, and I don't think we do a good job negotiating it. So if you can't get that salary that you want upon hire, then instantly start talking about how to acquire bonuses. And typically you can acquire bonuses by improving outcomes. So for example, you start at a facility, they might have a fall rate of 40%. And you might improve that fall rate within that quarter to like 14%. So start looking at numbers, okay? When you, if you can't acquire that salary upon hire, talk about, hey, what kind of bonuses can I acquire if I improve certain outcomes that we have in this facility. Okay, and typically the role of the DON, you create job stability for yourself. All right, it's a Monday through Friday position, allegedly. Monday through Friday position, but it's stable. Okay, so you don't have to worry about going and work another job or anything like that. Okay, so those are just a few of the pros that I wanted to bring out. Now let's talk about the cons. Let's talk about the cons. It's a lot of paperwork. Okay, it's a lot of paperwork that goes into being a nurse, director of nursing. Okay, the other thing is the regulatory compliance aspect. Okay, long-term care regulations, they change, and they change pretty frequently. So you constantly have to keep up to date with all of the regulatory compliance that goes along with on the federal and as well as the state level. So that's another con, especially if you are working for a company and you might not have that support as a regional nurse consultant. This can really impact you because you're not keeping current on the changes that are being made. Another con will be sometimes you could be staff challenged. All right, staff challenge, unfortunately, can really disrupt that role of the DON because you're putting more hours in on the floor rather in your role, but you still have to get everything done in your role as well. So I would say that is another con, okay? And sometimes this position can be very stressful, okay? It can be very stressful if you don't have a plan in place with your day-to-day operations of your facility, okay? So those are just like some of the pros and cons that I want to start thinking about. I want you guys to start thinking about if you are looking into accepting a DON position, okay? Now, of course, there are much more, but I think that those are like the top, okay? Keeping up with those regulations, being compliant, staff challenges, your salary, but overall, the overall position can be an amazing position if you connect with the right employer. All right, so those are just some of the pros and cons of being a director of nursing. Like, comment, and subscribe, and I will check you guys next week.